For more stories like these, go to www.social-tv.co.za, subscribe to us on YouTube and follow us on our social mediums.
The headline reads, COVID-19 threatens South Africa's medical waste management systems. I don't know how many of you have thought of medical waste over the last 4 or 5 months, but the CEO and founder of GoGo Logistics, a medical healthcare waste service provider, Sibakazi Mancha has. We have a chat to her about the threat, whether it's real or not, on our social newscast with me, Sam Marshall. Sibakazi, thank you for your time. Let's get straight into it. Why do you think that COVID-19 is threatening South Africa's medical waste management systems?
Well, first of all, medical waste is actually the disposal or the transportation as well as the disposal of waste. So if it is not handled and disposed properly, therefore it can cause increased infection. We do know of the incident that took place in the Eastern Cape as well as in the Free State, whereby the medical waste was dumped on the roads. So imagine if someone was actually walking on that road, they could have been infected by the virus. So therefore, it is quite essential and very, very important to make sure that the waste is disposed properly and safely.
I've got to be honest, I did not even begin to think of medical waste. And now talking to you, obviously, it makes perfect sense. But
yes,
you're on the ground, you're engaging with various departments, various hospitals. Are they medical waste savvy?
Well, I think there needs to be training that needs to be rolled out, because I think that they're still doing things the old way of handling waste, whereas this is now a new pandemic, and also you can imagine the amount of waste that actually is handled in the hospital a day based on the number of COVID-19 tests that are conducted on a given day. So I think there's a lot of pressure there, and I see that there's also a shortage of staff. So therefore, it makes it difficult for them to actually handle it properly. And also, as I mentioned, the lack of training as well. There needs to be training that needs to be, rolled out to make sure that everyone is aware. And then we also are aware of the shortage of PPE as well. So if there is no PPE in the hospitals, the staff is not wearing PPE or correct or proper PPE, therefore, that could also cause harm and increased infection.
Sibakazi, are you saying that for this COVID-19 pandemic, that there should be a consideration of also sharpening up the handling of medical waste, and that hasn't happened?
I think yes, I believe so. I believe that I'm not saying that, I wouldn't say that it hasn't happened. I just feel that in certain institutions there is leakage, especially if you look at the clinics in the rural areas, you find that the staff, they are under a lot of pressure. The problem is the pressure. So to do things efficiently is very lacking there. So and I believe that if the partnership between them as well as the transportation companies, because remember the companies that are handling and transporting the medical waste, they have been trained, or they should have been trained, just like us. We have received our training. So they should also advise the hospitals and the clinics and, the healthcare sector on what is the proper way of managing and dealing with medical waste.
Give us an understanding of what constitutes medical waste.
Well, medical waste is actually, the bags that are being handled. Well, the needles as well, the needles that we use in the hospital. So all of those things, they then constitute to medical waste. And what needs to happen is they need to be stored in, we now have COVID-19 bins that are actually specifically for COVID-19. So they need to be stored there. And the areas that actually handle medical waste, they need to be far away from the patients and far away from the visitors in the hospital. That's where then the transportation companies have to pick it up on a daily basis in those containers. What happens now is that it's actually being collected in in containers, or sometimes they even collect them in those black plastic bins. So you can imagine, then that's where the problem is. And after it's been collected, it needs to be disposed properly in the proper disposal site, where the licensed disposal site. So that is what is lacking currently in South Africa.
When you say that's currently lacking, are you saying that you've witnessed how medical waste is being disposed of currently?
Well, we saw it on TV. Hey, it was on TV. We saw it happening in the Eastern Cape. It happened in the Eastern Cape that the medical waste was disposed on the road. So yes, I can say I've seen it. I think we've all seen it in our own eyes, because it was on TV. The medical waste was dumped on the road with the test results of patients. So yes, it has happened.
Have you, as a service provider in this space, are you currently aware of any communication on any level, which you've either experienced yourself as an organization, as a company, or represented by an organization? Has there been any communication from government, from the Ministry of Health, around the management of medical waste during the COVID-19 period?
No, we haven't. We don't. We only communicate with the hospitals when we go and collect waste, but we don't have any communications with the ministers or whatsoever. No.
So your concern around the way medical waste management and the systems put in place, so you have a genuine concern around that?
Yes, I do. I do have a genuine concern based on what I see. Like I've mentioned, what has happened, we've seen it twice. So for me, I'm raising awareness that everyone needs to be aware that the medical waste is very critical, and it could cause increased infections if it is not transported or disposed properly by the licensed medical waste transportation companies. Therefore, it is important then for when we are doing the procurement, or when the companies, the hospitals, etc., are sorting out the medical waste transportation companies, they need to make sure that they use licensed companies who have actually been trained to do the job, in order to reduce the spread of the COVID-19 and the improper dumping of and disposal of the medical waste.
The management solution that you're talking about is using technology to monitor and track how waste is being collected, where it's dumped, how much waste is collected. And technology is what you're saying is how we can then make sure that we are following the proper waste management systems.
Yes, well, in terms of, if you're talking about technology, yes, there is technology in place whereby each and every bin that's been collected from a hospital or from anywhere else, it can actually be tracked from the point of collection to where it is disposed. And after it is disposed, the hospital or the clinic or any healthcare sector will receive a certificate from the transportation company that shows and proves the quantity of waste that was disposed, that was collected and that was disposed.
Final question: as a 100% Black female-owned business in Go Girl Logistics, have you seen an increase in business?
Well, yes, definitely. We have since the lockdown, we have seen an increase in business, because Go Girl Logistics does not only do medical waste, we also do refrigerated goods transportation as well as normal courier services. So yes, there has been a lot of a big increase actually, especially from companies that had to lay off their staff. And some they had to, cancel some of their vehicles, the contracts that they have. Now they use outsourced companies. So yes, we have seen an increase in business, and we are very grateful for that. And we are actually very grateful for the opportunity for us to assist and to be part of the solution in terms of the COVID-19.
So that's Sipokazi Macha, founder of Go Girl Logistics, talking to us about the impact of COVID-19 on South Africa's medical waste management systems.